Hi, my name is Caitlin Dale and this is video 38. So I am wearing my PPE here, gloves at a minimum. First I am going to remove the attachments from the dental machine here. So from the hand pieces I'm just going to inject the three-way syringe tap piece here. I am going to use the little scaler tip attachment here to remove it from the top. Just loosen it up so that I can then twist it off and remove it. I'm going to place both of those into the enzymatic cleaner along with my two handheld instruments here, winged elevator and handheld scaler, to start cleaning. Any burrs that were attached, ours are all disposable in clinic, so I can pop that in the sharps container here. I'm going to use some warm soapy water to clean the entire machine, all of the handheld attachment pieces and the actual dental machine itself. Just make sure there's no blood, tissue, dust or dirt or any gross contamination on there. Once that has been cleaned, I'm then going to use the F10 disinfectant at 1 to 125 ratio for 2 minutes to disinfect the machine. Once the 2 minutes is over, I can use the paper towel to just dry the machine thoroughly here. Next I am going to lubricate the machine. So I am going to do that as per manufacturer's instructions from IM3 using the MD30 lubricant. I'm going to take the low speed handpiece and disattach it here, and I'm going to pop 4 drops of that lubricant into the smaller hole here. That is the air inlet hole. I'm then going to pop the piece back together, and then I am going to just expel any excess lubricant by pressing on the pedal for 30 seconds. I am now going to repeat that for the high speed handpiece, and then we can move on to cleaning our attachments and our handheld dental instruments. So pop that all back together and expel for 30 seconds. Now I'm going to move over to cleaning our instruments here. So they have been sat in the enzymatic cleaner. I am going to get a bristle brush and clean each of those instruments under water. Rinse with distilled water and pop to dry for a second. Winged elevator again under the water. Distilled water to rinse, and then pop to dry for a moment. Three-way syringe tap, rinse with distilled water, pop to dry, and then the handheld scaler, making sure you get into all pieces of the handheld instruments. Rinse that here, and then I'm going to use my microfiber cloth to ensure all of those pieces are thoroughly dry. Now I am going to sharpen those handheld pieces. So we use a stone, we can use it with water or oil. I am going to use it with water in our clinic here. So I have my winged elevator. I'm going to use the conical part of the stone. I'm going to place it at a 45-degree angle, and then I am going to just slide up the stone. With the scaler, I am going to just get the scaler here. Again, place it on a flat surface. I am going to place it at a 45-degree angle. I'm going to use my index finger on top and my fourth finger to balance and keep it straight. I am then going to slide down in a pull action, making sure both sides are sharpened. You do need to ensure you are checking your instruments for function, sharpness, wear and tear. So you can use a testing stick to make sure they are sharp enough to perform their function, and then checking them for wear and tear at the same time so you can replace them if needed. So next we are going to pack our kit. So pack our dental kit, and we're going to pack our handheld instruments and attachments. So I am going to pop the winged elevator and the handheld scaler back into its stainless steel container. I am going to pop on a autoclave tape to keep the container closed on the inside. I am then going to, sorry, actually I just forgot to put my indicator strip in. Indicator strip on the inside, put the tape across the front and pop some striped autoclave tape on the front too to indicate when it's been done. I'm then going to label what it is, so Canine Dental Kit with the date and my initials. I am going to pop that into an autoclave bag, and then again I am going to label the autoclave pouch as well. So fold that over. I'm then going to seal the bag up, making sure there's no gaps at the side, and write what it is on there, the date and my initials. The attachments here, so the 3-way syringe tap and the scaler tip, I am going to pop them into little individual pouches. So the little small pouch here already has the chemical strips on the inside and the outside, so I am going to just pop that straight on in with no indicator strip, seal that up, and then write what it is, scaler, tip, the date and my initials. And then I am going to pop in the 3-way syringe tap with the indicator strip into a separate pouch, fold over, and then again making sure I label what it is. So 3-way syringe tap, the date and my initials. Thank you very much. Caitlin Dale, resuming video 38. So sharpening your instruments is really important. It helps extend the useful life of the instruments, as well as preventing injury of both the patient and the user due to slippage. Autoclaving all of the instruments is super important as well to prevent cross-contamination between patients. There's a lot of bacteria in patients' mouths, and you don't want to be using instruments that haven't been autoclaved between patients. Thank you.